Good afternoon. I'm Tracy Young. I'm with the Carbon County Prevention Network. This is our monthly Carbon County Conversations from classroom to community. This is a monthly thing for us. We've just been trying to bring educational information to the community about what not just the network is doing, but we've done some conversations with the hospital and higher ed and some of the things that they're doing. And this will be every month for our grant renews in July. And so we'll just keep on doing this. And we're hoping to get a schedule of activities out for the upcoming conversations here very soon, so that you'll be able to see sort of a year in advance what we're up to and what we're doing and what our conversations are going to be about. Today I'm going to talk about suicide prevention in Carbon County. May is Mental Health Awareness Month, and the grant that covers the Carbon County Prevention Network is really more suicide prevention based and substance abuse prevention. So while we're going to talk about mostly suicide prevention, that's because our world is really trying to provide trainings around suicide prevention and not necessarily delve into the mental health as much. We work with our partners around mental health and hope to bring those resources to the community. And so we're going to talk a lot more. We're going to talk about suicide prevention and those resources in our community. We're hoping that we can continue to connect with our mental health partners so that we can bring more information to the community about what's available for mental health. But this is specifically about the trainings available around suicide prevention in Carbon County. My computer doesn't want to cooperate.
Fantastic.
Of course, best laid plans, right? So one of the first trainings that I want to talk about is QPR training. That stands for Question, Persuade, Refer. And I always encourage people to start with this training. It's about a 90-minute training, and it really talks about, it is for anybody. It talks about the language within suicide, and their motto is, we can all save lives. And so we really hope to get this training out to the entire community. And if you don't have the want to do larger trainings or 2-day-long trainings or week-long trainings that we offer, this one is perfect for people that just have an interest in being sort of a gatekeeper, is what we call it. And we want to reduce suicidal behaviors. And so that's what we're looking for in Carbon County and everywhere that we work. Rachel's in the room. She's one of our QPR trainers. And we are working on getting about 10 other people in our community of Carbon County trained. And so there's some people out in Bags and Saratoga, and so we're kind of hoping that throughout the county we're going to have several trainers, and that we can offer QPR throughout the community at like once a month is our hope that we can offer this. I always recommend that anybody that just talks to people on a regular basis, like bartenders, people that work in a salon, coffee shops, people that you see on a regular basis, they see the same people over and over. And so QPR really gives you that, just that lens of wanting to save lives and think along the lines of suicide prevention. Another training that we have available, and this one, oh, that's weird. That's not what my screen looks like. Let me exit out and see. Sorry, technical difficulties. Let's try one more time. There it goes. There we go. So mental health first aid is really talking more along the lines of the mental health. So it sort of gives us that other lens of mental health. So when we think about CPR for health, this is the CPR for mental health. So mental health first aid is what we, so it's really looking at signs and symptoms, then how to interact with a person. And this one is a day long, so it's like a 6-hour training. Right now, We've got a couple of trainers we've got actually like 6 trainers in Carbon County. Our school district has a program here in Carbon County School District 1. They have a program called Project Aware. And that one of their goals was to get more mental health first aid to all of the staff within Carbon County School District 1. And so we have worked with Project Aware. We've partnered with them to make this happen. And mental health first aid really is that. We're talking about mental health. We're really trying to engage the community around mental health and what that means for the community. Assist is another one of those. I'm going to do this every time. So Assist is one of those longer trainings that I sort of talked about. We recommend this for people that are engaged with clients and really are this gives you, it's a 2-day training, and at the end of the training you really are able to ask the tough question of, are you thinking of killing yourself? It is important to be able to ask that question. And it's a very tough question and it's a tough conversation, but it gives you the skills to be able to do that. And we really recommend this for people that are, counselors, or we love when like teachers have it. People that really see the same people every day and are working within a world where we know there's a lot of mental health, a lot of anxiety, a lot of those things that we're looking for when it comes to suicide prevention. And this is, we are going to have an Assist coming up here pretty soon, and I'll give you those dates at the end. But Assist is a really incredible program, but it is 2 full days of talking about suicide. At the end, you're also able to help somebody create a plan as an alternative. How are you going to get through this crisis? And so it really is sort of that next level. We've talked about QPR, and then we've talked about mental health first aid. Assist is sort of that next level. And then one of our newer trainings in the community is CALM, and it's counseling, conversations, collaboration around lethal means. In Wyoming, 75% of our suicides are completed by firearms, and it's exactly that. It's a lethal means. Very, very, very rarely is there an attempt by a firearm because they are so lethal. Most of the time, it's a successful completion of suicide. And so CALM is one of those that in Wyoming, do you want me to restart?
Yeah, I think we'll have to restart both.
Okay.
For it to go away,
So are we just pausing for a minute?
Yes, we'll take a quick pause.
Okay, we're gonna take a quick break. We'll be right back. Don't we love technology?
Yeah. Great when it works.
I know. Just that?
Yeah.
Okay.
Computer.
Is it not Tracy's?
Yes. Sorry.
It's my computer or the TV?
This whole portion.
a lot of information.
I know there's a lot of.
Okay. All right, thanks for that. So I left off with calm, and like I said, this is a fairly new training that we're really trying to encourage people in Wyoming. Of course, as we know, people do not like to talk about their guns. They don't like to be told how to store their guns, how to use their guns. So this really does come as just a safety issue. We really approach it as safety. So we're really looking to talk about, so all the other trainings that I've already talked about is the why. We're trying to figure out why. This training is really talking about the how and how we can reduce the means of suicide in our state, in our community specifically. This is a really simple training. What I really like about it is it's very simple. It's very much just talking about safety. We're asking people to, so there's 3 different trainings essentially. Counseling, and that's done by counselors. We have mental health trained people doing this training where they really are counseling people on do you have a plan? What do you plan to use? Sort of those things. But there's also trainings around just conversations, really just starting this conversation in our community. And as we know, with the stigma around mental health and suicide, just the conversation is really important. So really this training is trying to start those conversations. And like I said earlier, it's not an easy conversation. None of us really want to get down and talk about suicide. It's not a fun topic. It's a very tough topic. But we have to have these conversations to continue to break that stigma. And this training really is teaching us how to have those conversations. How do we talk to people about their stressors in life, and how do we talk to their loved ones on how we can help them? What we're finding is that if we can convince them just to have their guns either stored elsewhere for a while, do you have a loved one? Do you have a brother? Do you have a friend that you would take your firearm for a couple weeks just till you feel like you're out of crisis? Most of the time they're willing to do that. Yeah. Some of the other strategies we are talking about is do you have a lockbox that you can just put your gun in, and that second of impulsivity is taken away when you have to unlock, get your gun out. We've even had, some of our trainers have talked about they've seen people put pictures of their family on their lock boxes where their guns are. So when they go to that lock box, they have to look at that picture. And it gives them that second of, and I could go into this training because I really do love it. And we do talk a lot about, it's also a lot of research behind this that we're finding that suicide is a very impulsive act. It is not most of the time planned out. We're talking 75% of our suicides or more are within seconds of thought. It's not, we always want to think that it's that long-term mental health person or, but a lot of times it's something major. They may have mental health issues, but there's something that happened that has just put them in a place where they think there's no other answer. And so we're trying to, with having the conversation around lethal means, we're trying to take away that impulsivity. We're trying to have people take a breath and think about it. But we can't do that if we aren't having the conversations. And so that's why this training really is starting to have those conversations. All of our trainings are doing that. This is just a little bit different. It's a little different than what we've been doing. We've been talking about the mental health signs and symptoms of suicide. This is really talking about how people are completing suicide and how we can take away those means and lessen those means. And another piece of it is collaboration. So who do we need to collaborate with in our community to continue to have these conversations? There is a program called Hold My Guns. It's a nonprofit, and it's specifically for people that are in crisis and need to store their guns. It's been around a few years. There's one in Laramie. It's the only one in the state. But our federal gun laws just changed, so it's making it harder for him to do that. He does it, you can bring your guns, store them for free if you're in crisis. That's part of this program. But now, if they leave a gun with him, they have to do a background check to get their gun back. That wasn't the case, that's new. So in the sense of lethal means, that's not helping us. It's good for some other things, the background check, but there is a piece in new legislation that's going to make it tougher. And so we're really, as a state, talking about how can we help, and it has to be somebody that has a license to sell guns. How can we make this happen, but not hurt their business or make it so impossible for people to get their guns back? Because they'll never give them up. They have a hard time getting them back.
No
Yeah.
way.
Yeah, exactly.
No
Yeah.
way.
It's their personal property. And so that's a piece of it that we're working on. It is a statewide initiative that we're talking about at the state level, talking about how can we make this work in our state, in a state that really likes their guns. In the training, we do talk about how Wyoming has, so in the United States, it's the average household has 7 guns. In Wyoming, the average household has 9 guns. So we're always ahead of the curve in something, and that's one of them. So that's why this training is really important. And we do cover other lethal means, other means of suicide within this training. But obviously, since this is the majority of the way people complete suicide, this is what we're talking about in this training. So I feel like I ran through that really fast, but I also wanted to give time for some conversation if you guys want. If you're not aware, we do have a 988 number now, which has made a very big difference. There's not a 1-800 long number. You can call or text 988 at any time, and somebody will respond. I think Wyoming has finally bought into this, so we do have a couple call centers in Wyoming. So when you reach out, you're going to get somebody in Wyoming based on where you're calling from. It used to be based on the area code of the phone number you were calling from. Now it's based on where you're calling from. So you're going to get actual Wyoming help if you call the helpline. And then for veterans, you just dial 988 and press 1, or 9881 text for a response. Did you have a question? Go ahead.
Did you say how many suicides we have a year in Wyoming?
I should have pulled up the recent stats. I know in Carbon County, just in the last year, there's been 3. So, so we're still the highest. We flip-flop between Montana and
Wyoming
Alaska.
is the highest in this, well, that's like sucks.
Yes, we typically are.
We have been for years.
Yeah, we have been for a long time. We flip-flop between Montana, Alaska, and Wyoming. There's something about those 3 states that we're always in the top 5. So, I mean, everybody has their theory, but why do you guys think that is? Why do you guys think Wyoming has such a high suicide rate?
Maybe the cold weather?
The flipping wind. Oh, sorry, I didn't mean to say it that way.
No, I'm with you on the wind. Today's a good day.
Wyoming PDS just is doing a month-long series on this. And I think their Cowboy Up, some of that component plays a big role.
Yeah.
It's a big cultural paradigm and people, whole families indoctrinate each other to that. And it's hard, you can't throw the baby out with the bathwater, because there's some real stand-up things that are a component of that make us exceptional. But yet there's all, so.
Oh, this works out. So it's definitely a lot of the things, and I just happened to have read a paper on this recently, so, and pulled our statistics for Wyoming. But we had firearms as the leading cause of suicide in women, 38% as of 2017. And they did the whole report on it for the Department of Health, and it was lack of services, stigma, and not necessarily weather, but isolation.
Yeah.
So
The weather doesn't help the isolation
Right.
either. Yeah. Lack of mental health services, and if they are there, you can't get in fast. So that number, the 988, and I have seen it advertised a lot more in Wyoming, so that's awesome.
Yeah.
But I think having that is huge.
Yeah, absolutely. I feel like you're actually talking to somebody in Wyoming.
And immediately.
Yep.
So,
How about technology? That would be it. United States still, but I don't know about Wyoming. I mean, really, people are growing up in their phones.
With the
First-
kids, the youth.
And I don't know what the youth suicide rate is now
It's
compared to
creeping up.
before, but if it's getting worse, you dang sure can bet it's got something to do with phones too.
I think we're disconnected as a society, and I think,
Well, these schools are keep letting these kids keep their phones in class, which I totally don't understand. I don't know if they're doing it here or not, but I just hear that a lot. I'm going, how is that even possible? How can we do that? How can that be good?
it's similar to guns. It's your private property.
But you can't
We're not
just
gonna
take
take it away. There is a school in Torrington. They actually saw so much anxiety and mental health with their kids since COVID. They had the principal at the high school said, no more phones. And you can be mad at me, you can hate me, but that's what's happening. No more phones. No more phones during the school day. You can leave them in your car, you can leave them in your locker, but there's no phones allowed during the school day at their high school. And they are seeing incredible changes. And this is the first school year they've done it, and they're seeing incredible changes.
There they go.
Yeah.
I rest my case.
Well, and they still have technology, it's not just phones, they have laptops, but like in Carbon County, we have, flags. So if you search something, if I search suicide at school, it flags automatically to admin, and automatically they're gonna pull me. So that, I think they have it in Carbon too as well, so.
Yeah.
Yeah, I think that's pretty cool. If you flag something with guns, period, if you type something inappropriate, you're getting flagged.
Yeah.
Yeah.
So there are some good things, if we can find ways to use, the internet for our own good purposes, things like that, it is a good. But I think with youth, they feel instant gratification. They're always looking for that, like, oh, did you like my post? Did somebody respond? Instead of just being connected to one another and just, learning from each other.
It's also sad though, because you also see things you weren't invited to.
Yes.
So people are posting their parties and their events and kids aren't invited to them. And it causes lots of stress and depression, and I know it's crazy. So,
Yeah.
Well, and I think
yeah.
parents technically could say, this is actually my device. I'm giving my kid permission to use it, and that gets kind of tricky sometimes.
It does, and that they really struggled with it the first part of the year, but the principal said, just go with me, just give me a year, and I promise we'll see changes, and they're seeing big changes. And the kids actually are like, it's kind of a relief. That's what they're saying. They're saying it's a relief to just
Turn it off.
turn it off and be with my peers. It's really a relief. So I think we could all learn from that, right?
I take my phone from my kid on occasion when he gets in trouble, or I take his phone, and it's like punishing me. I hate to say that,
I
but
know,
it
it's
is.
true.
It's
It
like
is
punishing
true.
me,
It's
but
true.
after about 2 weeks to 3 weeks, I'm like, welcome back, buddy. It's good to have you back. Yeah, and I'm like, okay, you're not getting your phone for a while.
Yeah.
We're gonna slowly ease you back in.
And we did that with the other electronics, like so the Xbox even that they talked to. I take that for 2 weeks and that's a completely different game.
How old is your boy?
He just turned 15, he's a freshman. Yeah, so and he's super busy, so he doesn't have a lot of time, but on the weekends he will. But if I take his phone, I can see a noticeable difference. Like mental health wise, I can see a noticeable difference with him, his attitude, every bit of it. Then when I see it, I'm like, oh, welcome back, bud, good to have you.
I think I grew up in really rural Arkansas, like we had 7,000 people in our entire county. But I think there is a culture in the more rural of just kind of an independence, to be strong, to make it through, to not ask for help, reach out for help. So,
Absolutely.
it's a small community, but we've had an inordinate number of suicides. And I think there's something in our culture. It's like, it's a beautiful thing that we're that independent and we try to be strong, but there's a dark side of that I think we have to, especially young kids, have that shift, while they're young.
Yeah, and it's okay to ask for help. It's okay to
It's
talk about it.
important, it's the smart thing that becomes the default.
Yeah.
It's like, I'm struggling, I get help, instead of the default being, I'm struggling and somehow I gotta get through this by myself.
Yeah.
You
Some of
definitely
the-
see that here.
Some of the other pieces we're working on, so we're just finishing up a grant cycle right now with the community prevention, with Carbon County Prevention Network. And in the next grant cycle, one of the, there's a suicide prevention out of Colorado called Man Therapy. If you guys have never seen it, look it up. It is hilarious, but it really gets to the heart of men asking for help, and it's okay to ask for help. Because we're still seeing our highest rates are still middle-aged men, and so we're trying to do things like that. So all the way around, we're trying to look at suicide and mental health and how we can break down that stigma within every group and hope that we can connect all the dots and connect each other in different ways. And so, but if you get a chance to look at Man Therapy, it's a really great, it's a really great strategy just to talk about it. It's okay to talk about it. It's okay to talk about it. It's okay to stress, be stressed. It's okay to struggle. And I think just the stigma in general, you know, there's a lot of factors to suicide prevention. We're human, so there's a lot of factors. You can't point to just mental health. There's a lot when it comes to suicide. And I think human connectedness is probably one of the things we're missing the most. So the goal of the coalition is to really provide all these trainings, but continue to connect. So we'd love to have, so here's some of our trainings that are available. Like I said, the assist training is open to anybody. And if you really want to be a QPR trainer, we'll love to have you. But we are asking anybody that signs up to be a QPR trainer to do 3 QPR a year. So we'll ask people to sign like an MOU just saying that they'll do that. Just because it's quite a bit of money and we want it to continue. So we're hoping we get people trained that will go out and share this training with the community and train others. And then just in conclusion, suicide's preventable. And as a community, we have to come together for it to be preventable. The coalition is just a piece of the puzzle that we hope we can get more partners and more community members. We have a lot of organizations at the table, but we love when we see community members come to things like this and want to learn about suicide prevention and mental health in our community and the things that we're doing. And then just in conclusion, what can you do? Talk about. Take a suicide prevention training, talk to your peers. I always tell the coalition, you have to talk about this. We can't leave this room and just wait till next month, till the next meeting. Talk to your peers, talk to your family, talk to your colleagues, your friends about prevention. What is prevention? What does it mean in the community? And so that's the big piece of it. Get involved in the coalition. Like I said, we have meetings every month. We have one here in Rollins and then we have one in Saratoga. Every month. There's some contact information there. If you want to get involved, you can either email Rachel, is one of the coordinators, and myself, and we'd love to hear from you and love to get you involved in any way. And that's all I've got, but if you guys want to continue conversation or have other questions about what the coalition does, or
Well, 2 things, just food for thought, along with that Wyoming PBS show on the, they did one of their segments was on the stress of poverty and how that gets almost passed down. The little babies and little kid, it's literally visceral, and it can be generational too. It was really enlightening about how stressful poverty is.
So one of the things we provide here in Carbon County, because Carbon County is one of the poorest counties in Wyoming, is it's called Getting Ahead, and it's a Bridges Out of Poverty strategy. We offer it to anybody in the community that wants to take it. It's a 12-week course that really helps families understand how to budget, how to meal plan, and then other resources, how to learn about finances, how to work together as a community. It's a really great training. We've been doing it for a couple years, and I think we're slowly building on it. I think most classes we have, 10 people start out, graduate 8. They get a stipend. They get to have meals with their kiddos. So we do it at Head Start, where they prepare a meal, sit down. One of the best protective factors is family dinners. So we really try to encourage that. So definitely poverty. The PBS special, if you guys are interested, I can email it to you, so just shoot me an email. We actually participated, they did at the theater over in Sinclair, and we had a panel, and we talked about the PBS special and what they were doing,
Wow.
and had the producers there to talk about, you know, what this special is, what it means, and then they kind of did it in a handful of communities across the state. But they're really trying to get to, you know, the gist of what's happening in Wyoming. It's a really great.
It's really outstanding, and
Yeah.
really just that it's out in, it's daylighting, it's getting, conversation is getting out from behind closed doors and just out and about is pretty impressive. I mean, I think it's impressive.
Yeah, absolutely.
And just so you know, because I know the Perrys are involved, and Tasha and I were involved with the Faith Community Cares multi-church group. I think we'd be interested in pursuing CALM at least.
Absolutely.
And I wanna get certified, so I have my calendar clear for the 17th of July. How do I sign up for that?
Shoot me an email, and mine is the Community is Prevention, and I can send you the information.
Because then I can present to St. Christopher's and I can present to Boys and Girls Club.
Oh, so we wait for you to get, well, that would be great. Is there a cost?
No,
Is there-
no, none of
It's
these
just
are at
time.
cost to
It's
the
just
two
time.
community members. It's just your time.
Okay.
And then let me know. I think there's only 3 CALM trainers in the state. I'm one of them, and so
Oh,
Just-
okay.
connect with me and we can make that happen. We try to do tandem training, and so my colleague in Albany County, because I also work in Albany County, would come over and train with me. So we're working with the sheriff to try to do some stuff with his classes that he's teaching here, firearm safety. So we're really trying to connect the CALM training with firearm safety here in Carbon County. So we'll see. That's one of our goals this year, is to connect that a little bit more.
You mentioned the faith community. Is there a strong ministerial association in town?
Well, this is in place of,
Okay.
this is in lieu of,
Okay.
yeah, and our CP is involved too. We've got a couple representatives from Rollins Cooperative Parish also. But it'd be nice to be able to integrate that component.
Absolutely. We'd love to have you.
Yeah.
Yeah. We're also, Carbon County's been wanting to do an awareness walk. So the goal this first year of the grant is to go see how other walks happen.
Yeah.
There's 2 ways to do it. You can do AFSP, which is a national organization around suicide, and that walk is called Out of the Darkness. You've probably heard of it. It's a pretty popular thing. Those funds stay with AFSP, which is a great thing. They give us lots of materials. I mean, there's lots of resources within Wyoming. Or the community could put on their own, and the money can stay in the community for different, things around mental health and suicide. In Albany County, there's a brewery in town that took this on a few years ago, about 5 years ago, and we do our own walk, and all the money, like 1 year, we have a suicide prevention, or a suicide support group in hospice, so the money went to them 1 year. Just different things that have to do with suicide prevention and mental health in your community. So we've invited everybody over to Laramie if they want to see what a community walk looks like, and then we'll go to one and just help with an AFSP, and then make a decision, and hopefully in 24 or 25 we'll do our own, whichever one we decide we want to do. But we've really had a lot of people want to do something tangible like that, really get out and do something, to support that. They're a lot of work. So the grant we have is to change behaviors. So our goal is to change behavior. Walks are proven to be great motivators, but they don't change behavior just doing a walk. It is a great awareness event. So we have to be really careful how we use our dollars for that. So, that's the beauty of Department of Health. So we just have to be careful. In Laramie, we actually invited local counselors, and they have tables and they provide resources. So we kind of do a resource fair and an awareness walk, and it's called a Walk to Remember. And so we always take time for people that are there to say the name of a loved one they've lost to suicide. And then all of our counselors wear different colored shirts so people can see people in the community that are counselors, certified mental health specialists. So that was our way of being able to fudge the budget a little bit over there. So, but I wanted people in Carbon County to kind of make their own decision. AFSP, they do all the work for you. It's kind of nice. And they're great walks. The Out of the Darkness walk is fantastic. I've been to several around the country. They're amazing. They're really great, and we could do both. But I wanted to give Carbon County an opportunity to kind of see both sides of it. So we'll go to Laramie in September as a coalition, and then there was just an Out of the Darkness walk at the University of Wyoming last weekend, a couple weekends ago. So, but they're all over in the fall, so we can kind of decide where we want to go.